Well, now to a personal story tonight about my recent battle with cancer. During Thanksgiving weekend of 2024, I discovered a lump on my neck. It appeared to be a swollen lymph node, which is usually a sign your body is fighting off an infection. When the swelling didn't go away, my doctor prescribed antibiotics. Weeks later, with the swelling still there, my doctor then ordered a battery of tests, which led to my cancer diagnosis. The cancer was in the back of my throat and it spread to my lymph node. Upon my doctor's advice, my wife and I decided to seek treatment with a head and neck specialist at Trident Medical in North Charleston. Tonight, as we wrap up Head and Neck Cancer Awareness Month, I'm sharing my story now with the hopes that someone out there will hear it and take preventative action. On March 5th of last year, doctors officially diagnosed me with metastatic head and neck cancer, a cancer caused by the human papillomavirus, commonly called HPV.
Back in the day, head and neck cancers were mostly associated with smoking and drinking. And most of these folks that get diagnosed with this particular kind of cancer don't excessively drink or mostly are never smokers. So this is mediated by a virus that is picked up in the body, and it remains in it dormant till such time that it becomes active and leads to mutations of cells, which leads to cancer formation.
What followed was 7 weeks of radiation. Each weekday morning, for 2.5 minutes, beams of radiation were aimed at my neck. During the process, I was wearing a customized immobilization mask. I was instructed not to move or swallow. That's because lying perfectly still was critical in making sure the X-ray beams hit the proper target. Also, not moving helped to limit radiation exposure to otherwise healthy tissue.
If you were to have a surgery, then that would have impaired your ability to speak and to swallow to some degree, as opposed to the non-surgical treatment. If the cancer is in a location where it doesn't affect that, then patients can opt for surgical treatment. But locally advanced cancers, by and large, will need radiation therapy.
As you might expect, the radiation ended up scorching my mouth. It made eating solid foods impossible, forcing me on a liquid diet for over a month, losing over 35 pounds. Then there was the chemotherapy, 6-hour sessions for 6 consecutive Mondays. The first session was simple enough, but then there were issues finding a vein. However, with only a few chemo sessions planned, a port or a PICC line were not recommended. The treatments left me very fatigued, a small price to pay in order to be cancer-free.
It is curable. Not everybody's cured like all cancers. And so this does have a very high cure rate, thankfully, due to advances in treatment. And that has to do with surgery, for example, robotic surgery through the mouth, for radiation, and there's new advances in radiation that can reduce the side effects of radiation, and chemotherapy, and now sometimes immunotherapy.
Doctors say at some point nearly everyone will get the HPV virus. It usually comes and goes with no issues, but for some it can lie dormant in your body for years and years, and in rare cases cause cancer, cervical cancer for women, head and neck cancer for men. HPV cancers are the only head and neck cancer seeing an increase in cases year over year. Doctors call it an explosion of cases across America, and no one knows why.
That's been really a hot research topic, and it appears that it was decades ago that this started, well before we knew about it. And looking back over those last few decades, we started to realize, wow, the increase in these oropharyngeal cancers is related to the virus.
I think there is a time lag in exposure to HPV virus and when it's appearing. And in fact, there is a fear that it is going to be seen in more older patients now, because now their exposure time is coming to that point.
Of course, I didn't go through the treatment alone. My wife was with me every step of the way, navigating our cancer journey one day at a time.
Absolutely. I mean, this is not just a patient going through it. It's a family, it's friends, it's co-workers. It impacts everything in life, and that's why we call it a survivorship journey.
And then there's the man who went above and beyond to get me the help I needed. My primary physician, Dr. John Fleming. In the span of 5 days, I had a CT scan, a PT scan, and a biopsy. I credit his quick response with saving my life.
Well, I'm very glad in your outcome. Unfortunately, there are some people who don't go to their primary care provider early enough. They wait around with symptoms and figure, oh, it'll get better on its own, or it'll go away on its own, and they go to their doctor when it's too late. I would just encourage patients that if you have something that doesn't seem right, especially a lump or a swelling somewhere, that you need to see your doctor and get it checked out.
Anything you notice, any pain, anything unusual, throat swelling, discomfort in the throat, any swelling in the neck, don't wait up. Because the longer you wait, the harder the treatment is going to be, the worse outcome is going to be.
And in case you are wondering, yes, there is a vaccine to prevent HPV cancer, but there are age limits, so be sure to discuss that with your family physician. And if you discover a lump anywhere on your body, take action immediately. Early detection like mine could very well save your life.